Good morning, and thank you for joining us for our CEO Leadership Series. This series is all about how we balance lives and livelihoods, moving together to safely manage the economy through crisis, recovery, and the new normal, survive and thrive. I am Pat O'Brien, Chair of the Regional Leadership Council, key strategic partners of the Wisconsin Economic Development Corporation. Due to constraints, we have shifted the production of the webinar somewhat. I want to thank WEDC and Secretary Missy Hughes for helping us to launch this series, now viewed by over 1,500 registrants. We are fortunate to have Missy with us today as a panelist. Thank you, Missy, for your support and for your time in moderating the successful launch. And thank you for taking time out of your busy schedule to be with us today. The Council is made up of the leaders of the 9 regional economic development organizations from across the state. Our role is to provide strategic input to and from our local partners in WEDC and to coordinate, develop, and execute regional plans that support our businesses, investors, and stakeholders in furthering globally competitive economic development in our respective regions. As you can see from the slide, these strategic partner organizations and executive directors include Visions Northwest, Momentum West, Seven Rivers Alliance, Prosperity Southwest, Grow North, Synergy, the Madison region, the New North, and my own Milwaukee 7. So why do we believe in a regional approach to the economy? Because businesses and the workforce are largely regional in nature. As an example, this heat map illustrates that Milwaukee Electric Tool, headquartered in the city of Brookfield, Waukesha County, employs people that live, play, shop, and pay taxes in all the counties of our M7 region and beyond. A heat map of their services and supply chain would look very similar. This is true of most companies. And here is an illustration of the mobility of the workforce in my region, which I'm sure is representative of all of our regions. Using M7 counties as an example, every county in our region has between 1/3 and 2/3 of its residents working in another county. We can't look past the fact that the region is the primary geography for businesses, workers, and just plain living, including COVID transmission. One way we are looking at the crisis, recovery, and next normal is through the eyes and interactions of the key participants. Today, you will hear how government, healthcare, and business is working together to help us get to the other side of this crisis and to better position us to compete globally. And make no mistake, our competition is not with each other, but is global in nature. To help us with our mission, we're working with Aurora WEDC, a world-recognized, Wisconsin-based business analytics, strategy, and facilitation expert. Insights gleaned from Aurora's global business engagements, combined with two-way feedback from our partners, business, education, workforce development, chambers, WEDC, and other community agencies, help us develop, communicate, and implement recommendations and strategies to support our respective regions. We are fortunate to have Aurora supporting our work through the crisis, recovery, and the next normal. And now I would like to introduce our moderator for today, Aurora WEDC founder and chair, Eric Johnson. Eric, take it away.
Thank you very much, Pat, and hello, everybody. Glad you're here today on this sunny Friday midday, and I hope you've all got a peaceful weekend on deck. You've all hopefully got your face coverings prepared as you go out into the reopened Wisconsin economy and are polite and careful about how you are interacting with those around you. We're going to cover some of that here today. We're also going to be going over a lot of data from some very special guests, and I'll have the next slide now, please, Austin. And we'll introduce those guests now. And if you wouldn't mind hopping on screen as I announce you, I think I can stay on here because one of our guests is not on video. But if you would, please hop on screen. Dr. John Raymond is going to be kicking things off for us today with his health update, who I think he's the best bedside manner in the Midwest, I think I've heard you referred to as. So thanks again, Doctor, for being here. After Dr. Raymond, we've got Ann Christiansen. She's the Director and Health Officer for the North Shore Health Department in Milwaukee. She'll have remarks regarding how the 86 health commissioners around the state of Wisconsin are approaching this new normal. We're going to ask for Missy Hughes, the one who really started this all 6 weeks ago now, doing this series of webinars, and I'm very humbled and honored to step into her shoes, and I hope I can fill them here going forward as moderator of the series over the summer to get her reaction. We'll then have Mr. Steve Loehr, VP of Operations with Kwik, give us some idea of how a company like Kwik, who's got, I think we decided operations in almost all, if not all, of the counties across the state, and the various different ways you're having to cope with that, as well as Jay Ellingson, who's the Senior Director of Food Protection. Excuse me, Dr. Ellingson, I think you're a doctor. And then our last speaker today is going to be Rick Chernick. He's the CEO of Camera Connection Connecting Point in Green Bay. He's going to be telling us about some really innovative Evolve to Thrive work that he and his colleagues there have been working on as well. So this is your panel. I encourage you all to get your questions in early. We have a whole team of expert analysts on the back channel who are going to be clustering those questions for the panelists here in the minutes to come, and make sure that we've got just the very best advice that we can muster from this very esteemed panel for you going forward. So next slide, please, Austin. And with that call to action on the slides, I'll turn it over to Dr. Raymond for your update.
Thanks, Eric, and good morning, everybody. If we could go to the first slide, I'll summarize the various indicators of COVID-19 as of yesterday, and I'll run through these quickly. The doubling time for COVID-19 was stable in Wisconsin yesterday at 16 days. The daily growth rate over the last 7 days was also stable at 2.9% in Wisconsin. There were 373 positive tests in Wisconsin yesterday out of about 5,500 that were administered, with a 6.4% positive rate. COVID-19 diagnostic testing was down slightly yesterday to 13,335, largely due to the availability of reagents. There were 352 COVID-19 patients hospitalized in Wisconsin yesterday, and of those, 120 were in intensive care unit beds. And of 1,450 ICU beds in Wisconsin, 375 were immediately available. ICU and ventilator capacity were stable and they were adequate. And personal protective equipment was improving to stable in Wisconsin, with the most critical current shortage being of medical gowns. Next slide, please. And in light of the Safer at Home ending without a statewide reopening plan, I'd like to discuss what we need to do to stay safe going forward. Remember that COVID-19 is stealthy and virulent, and it continues to live around us. We should not let down our guard. We favor a flexible, metric-driven, carefully phased approach to reopening the pandemic in hotspots, since that's no longer possible in Wisconsin. And this has been implemented at the municipal and county level in several jurisdictions. We encourage living responsibly with the only tools we have available right now: physical distancing, face coverings, hand washing, and frequent cleaning. And we all have a personal responsibility to maintain the health, safety of ourselves, our families, and especially our community. And I look to the public and private sectors to work together on a mitigation plan in case there's a surge or a secondary wave of COVID-19 going forward. Next slide, please. And on this last slide, I'd just like to highlight 6 key responsibilities for all of us as we try to stay safe as we open up our economy. First, we should give businesses clear guidance about how to help keep customers and their employees safe. We should provide adequate personal protective equipment, not just for frontline healthcare providers and first responders, but for our employees as well. We need to educate the public. We need to protect the vulnerable. Those would be at-risk patients with medical comorbidities, people in congregate living and working situations, and people of color. We need to increase testing of all types for COVID-19, PCR testing by nasal swab or saliva, antibody testing, and the new antigen tests. Finally, we need to enhance and coordinate the public health infrastructure to identify COVID-19 positive patients and to trace and isolate contacts. So with that, I'll turn it back over to you, Eric.
Thank you, Doctor. I have a question for you from the audience, if you're willing to take one right now.
Sure.
All right, and Ann and Missy, feel free to hop on here. We're going to run a poll here in a second, but first the question for Dr. Raymond, and then I'll pop the poll open when he's concluded. Can you update us on the status of the possible reagent shortages that Andrea Palm warned about yesterday afternoon? And there are some other remarks regarding the question, but do you have any remarks on that, Doctor?
Well, from the very beginning, reagents and the availability of swabs for the PCR test have been concerns for us, and they remain a concern because the supply chain is international. And people might recall there was a pretty significant shortage of the nasal swabs for the PCR test. About half of the world's supply originally were made in northern Italy, and that was one of the places that was hardest hit by the pandemic. And we're going forward, we're going to have to rethink supply chains really for everything. You know, we got used to a just-in-time international supply chain, and we're going to probably have to rethink that going forward.
Thank you. Missy, do you have any remarks since Andrea Palm was invoked there? Is there a state position on that? I think you might be muted still, Missy, sorry.
I was trying to be good, Eric.
Now we got you.
On the state side of things and at WEDC, we're continuing to have conversations with manufacturers around the state about the opportunities to help with those pieces of the supply chain that we continue to struggle with, and certainly reagents is one of those conversations. ProMega in Madison has been a company that has really helped the state access reagents, but we continue to work on that.
Thank you. Ann, do you have any remarks on that topic?
Only in terms of the impact of those supply chain issues at the local level for public health. That means fewer people tested with signs and symptoms, and obviously that is a huge concern as we start to look at contact tracing and investigation as our key tools.
Thank you. Well, I can't wait to hear more about that from all of you. We've got a bunch of questions starting to pile up, and we have a poll to run. So I'm going to launch that poll now. The question is for the audience, and I encourage you all to weigh in if you have a position on this. How long will it take for your organization to return to its pre-pandemic financial performance? And your options are less than a year, more than a year, but less than 3 years, more than 3 years, they'll never return to pre-pandemic performance, or I don't know. And be honest about the I don't know part. I see we've got about 50% of people who are responding thus far have said I don't know. So any opinions out there, panel, on this while we wait for a few more people to get their votes in?
Can I respond?
If you have any opinions on which of those sort of suits your organization, I know for my organization, I think it'll take less than a year, but my organization tends to be very counter-cyclical, and that doesn't necessarily help anybody else.
This is John Raymond. We're planning for more than a year. We hope we bounce back quicker than that, but I think it's just prudent to plan for the 1 to 3 year time frame.
This is
And
Steve.
I would say from the Wisconsin economy perspective, you know, we're definitely need to be thinking more than a year, less than 3 years, and that might be hopeful. If you look at what happened after 9/11, it took some time for a lot of different industries to really recover there. So looking at that long horizon, unfortunately, I think is a reality for the whole economy of the state.
Great, and Steve, I think you were going to jump in and you'll be our last one to comment.
I was just going to say, from Kwik Trip's perspective, we're always pretty optimistic company. We hope that we can rebound in less than a year, but it'll be closer to a year than months. So, but we're optimistic.
Well, you guys pretty much mapped to this opinions of the audience. Less than a year was 25%, more than a year, less than 3 was 42. I don't know was the second most highly ranked, and I think that's probably true of a lot of us. but pretty optimistic. The more than 3 years or they'll never return was very low, under 5%. So thank you, everybody. I appreciate your input on that. That, by the way, is our time horizon that we're measuring these longitudinal survey questions on. We really want to get your sentiment, audience, to tell us what you think and what you believe about the future. So with that, I'm going to turn it over to Ann Christiansen. Ann's got some guidelines for us on the 86 people that you didn't know were about to become exceedingly important in Wisconsin's economy going forward from the standpoint of health commissioners. Ann, take it away.
Thank you. I appreciate bringing the public health perspective into this discussion. I think that as we move forward, it's vitally important to have that interconnection between the business community as well as public health. So you could advance the slide. I'm going to tell you about COVID-19 from where we sit, and again, invite interaction and discussion around that. So next slide, please. There are 86 local health departments in Wisconsin. Most of these are county-based health departments, and I'm sure many of you have been in touch with your own local health department. We do a variety of programs and services that are rooted in state statute as well as community health improvement plans, so driven by community based on what their health priorities are. This circle gives you a sense of the all of the broad elements of our work. And infectious disease is where we sit today with this COVID response. Next slide, please. With regard to COVID response, the local health departments as well as the state health department are really locally monitoring our cases and feeding that information back to the public so we can have an understanding about what the disease burden is in our own communities. We obviously keep the public informed about clinical indicators like signs and symptoms as well as that surveillance information. We work on the control side and the prevention side for COVID-19 and working with our schools, our businesses, our municipalities to give best practices and guidance around how to protect those facilities and those institutions. But then if there were cases of COVID-19 in any of those places, work with them to control the spread in those institutions and facilities. And then another important aspect, which you've been hearing in the media, is tracking and tracing all positive cases of COVID and following up with those contacts who've been exposed, that being a critical element of our work as well. Next slide. So we've been talking obviously about safer at home. It's certainly been in the news this week. We have seen in terms of the progression over the last 2 months, the impact of safer at home. Obviously, COVID-19 continues to be this fluid and ever-changing situation. And at the state and local level, that there continues to be the building of infrastructure to respond to COVID-19 in a variety of ways. Next slide, please. If you haven't seen these progressions yet, this gives you an idea about why we know safer at home has been effective. On the left are the cases, the red bar showing that if we hadn't done a safer at home type mitigation strategy, this is what would have happened in terms of the number of cases. And then on the right, the number of fatalities that would have occurred, with the turquoise line being what did happen with these mitigation measures in place. Next slide. So we know, and there's been discussion about what would happen if we turn that light switch on quickly and experienced no mitigation measures whatsoever. And on the left side, that's what we would expect to see based on the number of cases we're on now. With the right side being, well, if we continue to have mitigation measures, where is the caseload going to be? What's going to be moving forward? So we really still want to focus on the right side and making sure that we're not oversurging the hospital systems to take care of our residents. Next slide, please. So I want to talk about public health's approach. Again, irregardless of the Supreme Court decision, our focus is still on that phased-in approach. We continue to want to use data to know where we are with regard to the spread of COVID, as well as with regard to the hospital system's capacity to manage those cases. So using data to help us understand where we are. And then looking obviously at best practices and guidelines so that we can get out appropriate mitigation measures that are going to make a difference for everybody, be it the community or the businesses, residents as individuals. And then that last element being workplace practices that ensure safety to allow for a reopening where people are confident that they're going to be protected from getting COVID-19 when they're out and about in the community. Next slide, please. So one question is, how do we continue to keep the curve flat in our next phase? And obviously, with the safer at home being overruled, we really do move into a next phase. And the next conversations will be around how do we collectively start to employ strategies for, be it our businesses or ourselves, that we can take responsibility for keeping that curve flat as a whole community, and that is no longer just driven by the safer at home order. So some of the plans that have come out in terms of guidelines for workplaces are from OSHA. I found those to be helpful in communicating to the businesses in my area. Some of those key strategies or very concrete steps that can be taken. Some of those include developing an infectious disease prevention plan. So identifying who's going to be that point person and what is going to be the plan should you have somebody, an employee that tests positive for COVID. So thinking forwardly about what you're going to do in that situation. Obviously, a number of businesses have already been impacted in that way, but for those who haven't, or who those have been reactionary, again, what are those plans going to be? Again, another element which we've heard a lot is what are the basic infection prevention measures? What kind of disinfecting is going to be happening? What's the frequency of that? What are those high touch surfaces? And then equally important is just developing those policies for when people do identify themselves as having COVID or been exposed, what are their options for sick time or off time, should they have the need for isolation and quarantine, and then communicating those protections for employees. So again, there are key strategies that the business community can do that collectively help us keep that curve flat. And that's what this message is for today. Continue. Next slide. So in terms of different workplaces, obviously risk assessment is going to be a key aspect of knowing what your organization is going to need to put in place for these strategies moving forward. And as we look at opening up and thinking about what the protection measures are, I really encourage everybody to kind of look at what those elements are for your own organization. So what is the level of contact between employees and customers? How many of those contacts, and what are the potentials for modifying the environment to, again, keep that socially distanced space between people and customers and to have those protections in place. Next slide. So there is a hierarchy of mitigation measures, and obviously these are things that we've been hearing more broadly, but as you think about your own business and reopening, consider how you're going to apply these approaches in your own workplace. So obviously physical distancing being one of the key mitigation strategies we have. Safer at home really is designed to be that physical distancing measure on quite a broad level, but how are we going to apply that in our own workforces and in our own lives to continue to keep people safe? And some of those kind of key strategies are, what are the work from home options? What are the options to split shifts, have people starting at different times? There's a lot of creative solutions out there, I think, that allow us to create environments where we're physically distant. And this is, again, one of those key strategies that people should be thinking about. Similar to engineering controls, again, recommendations for different barriers and different ways to separate ourselves with physical barriers. That's a key one that's going to allow for that physical distancing. And then again, administrative controls, redistributing those responsibilities so that there's less burden on any individual to be interacting with others. And then the final element is PPE. So we've talked a lot about that, certainly in the healthcare, but having options for people to wear those cloth face masks, keep themselves safe and protected, as well as to keep others safe and protected. Next slide. So if you haven't, I know that this is a WEDC conference or WEDC webinar, but there are a number of different guidelines on the website there that really give very specific sector level information so that people can know specifically for their own businesses where to go for that guidance. I also offer 2 other recommendations. So the Occupational Safe and Health Administration is one I've been referencing that provides some of that information about that risk assessment process that businesses can and should take. again, to determine what those measures will be for your own facility and your own workforce. And then Johns Hopkins also has a good phased in approach that, again, takes these principles of risk assessment and drills down more, actually even further in the details about different places and what those risks would be based on the vulnerability of their workforce, as well as the number of contacts and the association between those contacts. So again, those are two good federal resources as well for people to consider looking at for additional guidance.
Thank you, Ann.
Thank you.
Wonderful. Wonderful content. We've got a couple of questions from the audience that I want to throw out, but before I do that, I want to draw your attention to the chat panel in the GoToWebinar control panel. There are two important links in there, actually three. The first is the link to the Regional Leadership Council's 9 regional economic development organizations across the state. Those are the ones that are the kind of local boots on the ground for you guys to turn to as you're trying to figure out what to do as a business and what these guidelines are from a guidance standpoint. So please use that link to the RLC as your resource to talk to people where you live about what you need to do as a business owner, operator, employee, customer on this going forward. Second, Ann was very kind to include the WEDC's reopen guidelines link up there to the PDF. That link is again in the chat panel. Once again, it's wedc.org/reopen-guidelines, just like it's spelled. And then another link, the final link I'll draw to your attention is the UW-Oshkosh survey on COVID-19 impacts to business. I've been told that it's still running for another couple of days, and they're looking for as many more statistical inputs on that as they can possibly get. So with that, we're going to run another poll here in a second, but before we do that, and a question for you, and I think probably Dr. Raymond would be a good one to comment on this as well. Many businesses are not requiring customers to wear masks, yet employees are wearing masks. Since masks only give minimal protection to the wearer, doesn't this significantly increase the risk to employees as businesses reopen? And I'll just add to that, my understanding of mask wearing is really to prevent you more so from being more lethal than you need to be. So I'll turn it over to the health experts for an answer on that.
Yeah, I'll start, and then Dr. Raymond, you might want to add to that. In terms of from a public health measure, it is the recommendation of CDC and the Wisconsin Department of Health Services to wear cloth face coverings. So that would be the guidance that we would want people to have and to be aware of out there for public health right now. You're right, in terms of the protections, it's really a benefit for others rather than oneself. And we want to make sure that people are not wearing the medical grade PPE because we want to keep that for our hospital care personnel as well as first responders. So that element is out there in terms of the guidance and the recommendations as well as the effectiveness. Dr. Raymond?
Yeah, thanks, Ann. I would say it's the courteous and responsible thing to do. We all should be wearing masks in public. And think about the workers that are on the front lines. They're wearing a mask to protect you, and they're encountering maybe dozens or hundreds of people a day that are inside their 6-foot personal space bubble. We all should be wearing masks in public as a courtesy. And remember, this virus can be contagious while you are asymptomatic. So just because a person feels well doesn't excuse them from the responsibility of wearing a mask.
If I may add to that then too, in terms of there are PPE and wearing a mask is one protection measure, but that 6-foot distance and other strategies of hand hygiene and disinfecting are also important strategies. So we should be taking that comprehensive approach.
Thank you both very much. I'm going to ask Missy to come back on camera while I launch this second poll. The second poll has the same answers as the first, but the question is a little different. Missy, I was wondering if you could remark a little bit from the standpoint of the state, if you have an opinion on this or kind of guide this. How long will it take for your household to return to its pre-pandemic spending and consumption habits? Less than a year, more than a year, but less than 3 years, more than 3 years, they'll never return, or I don't know. Missy, what do you think?
Well, I'll just say that we're watching consumer data very, very closely, not only within Wisconsin, but also watching what's happening in other states that have already reopened, Georgia or Texas, to really understand, are the consumers ready to return to their pre-pandemic spending or not? And there's, some places where we're seeing a real resurgence and recovery. There might be a little bit of seasonality associated with building supplies and garden supplies, but we're really seeing that's recovering to pre-pandemic spending. But we're seeing, hard goods, durable goods, furniture continuing to lag. So, it'll be interesting to see how that all returns to pre-pandemic spending over the course of time, but we're watching it very, very carefully.
Thank you, Missy. Well, here's your results. 54% of our audience thinks less than 1 year, 26% more than a year, less than 3, 5% more than 3, 3% they'll never return, and 13% don't know. So pretty good spread there. Thank you again, Missy. Any other remarks from the standpoint of the WEDC on anything you've heard from Ann or Dr. Raymond?
Well, I just really would like to make the tie between what Ann and Dr. Raymond were saying as far as the social distancing requirements, the wearing of masks, the courtesies that Dr. Raymond referred to. These are really going to go hand in hand with the recovery of our economy. And, if we don't treat each other like the neighbors that I know we can, we're going to run into resurgences. We're going to have hotspots and step backs. And I think that's really going to affect consumer confidence and worker confidence. So it's really important that we take care of each other, that we abide by these social distancing requirements and all these other pieces of the fighting the virus puzzle, because if we don't, our economy is not going to recover. So those two things really, really go hand in hand. And, as we've seen throughout all of our conversations on our webinars, balancing lives and livelihoods, we need to be thinking about how do we protect public health, but also regain the momentum of the economy.
Couldn't have said that any better than you did right there. Well, with that, that's a good segue to Steve and Jay from Kwik Trip. Jay, I think you're on the phone, and we're going to make sure that you're unmuted so that you can be heard here as well. But Steve, I'm going to turn it over to you to tell us what Kwik Trip, I think one of Wisconsin's, most famous brands, the famous see you next time greeting that you get from every Kwik Trip employee, it seems. I have never had anyone fail to say that to me as I've been leaving a Kwik Trip. How's that going to work when everybody's got masks on in the future?
Yeah, a great point. Thanks for having us this morning. Before I start, I do want to really thank the agencies we've been dealing with through this pandemic, especially WEDC and DADCAP have been very open, and we've been able to have great interaction and discussions with them through this, and we really appreciate them being there for us. Just a little update on Kwik Trip. We're a family-owned company based in La Crosse, Wisconsin. 28,000 plus coworkers, about 18,000 of those in Wisconsin. We operate 760 stores in 3 states, including Minnesota and Iowa. 385 of those stores are in Wisconsin. I did look it up yesterday. We aren't in every county, but we're in every county, but I think 6. So, and we're going to look at taking care of those counties in the next year or 2 as well. We serve over 7.5 million customers a week in our stores. We're a vertically integrated company, meaning we have our own dairy, our own bakery, our own kitchen. We distribute all the products ourselves. We have our food safety lab, which Jay is an integral part of. And we're very unique in that we deliver every one of our stores every day. The challenges we've had over the last number of months here operating in this environment is we're in 3 states, and the 3 states had very different sets of rules during this period of time. For example, in Wisconsin, we weren't able to have self-serve coffee and fountain drinks and self-serve bakery, which have been big products, big categories for us. Where in Minnesota and Iowa, we were able to do that just as normal. We've had some supply challenges, especially in fresh meat products over the last number of weeks. Our sales have been very, very strong inside our stores, but gas gallons are down significantly this last week, probably still 30-35% down. So we've had challenges there, and I guess Jay, if you're on, if you could just interact a little bit and talk about some of the specific challenges we've had with COVID and how we've modified our operations there, and some of the best practices maybe that we could share with the group.
Absolutely. Can everybody hear me okay?
You can, Jay. You're loud and clear.
Okay. Well, I appreciate that. So again, and I'd like to reiterate too, Steve already talked about it, Dept, WEDC, and the local public health officials in all the counties we do business in. The communication has been wide open, so that's been outstanding. I just kind of want to begin with that. You know, we all came into this, there's no playbook for this, but, you know, Kwik Trip takes a very methodical, and we use science-based approach when we came into this event. And, you know, everybody's watching and reading, hearing the news, reading the newspapers, hearing all these anecdotal, you know, what's going to go on. And I think we took a step back and just said, okay, we've always had a rhythm in food safety dealing with if we have coworker issues and or if there's a health issue going on there, let's use that as our baseline. Let's use our, you know, food service sanitation policy as being the baseline. That really kind of focuses on three things when you look at that. And these are some of the things that we ratcheted up when we went into the program. When COVID, we felt the wave was going to be coming in our direction. First one is understanding that social distancing was a key element to keeping this virus, at least mitigating the virus in close proximity events that take place between our guests and our coworkers. So we understood the 6-foot rule. We also understood that the science out there and the data out there said that, you know, a 10-minute dwell time was kind of a window. So we stepped back and kind of looked at what happens in our stores, and we recognized pretty quickly that the dwell time in our stores for most of our guests is 3 minutes or less. So that was a positive thing. So we kind of took that into consideration when we started looking at how are we going to kind of help with the health and the cleanliness and work with our coworkers to make sure that they're hygiene and we clean the stores appropriately. So we kind of used that food service sanitation policy as a baseline, and then we went out to our employees or our coworkers and said, we want to provide for you masks to be used out at retail. We also want to mark out 6 feet in our store, so as guests come into the store, they understand that we know that the 6 feet is an important thing with social distancing. Second component out at retail is that we looked at all of our key touch points, and we didn't do this just kind of anecdotally. We literally looked at video to understand where are the key touch points in our store, not only by our coworkers, but by the guests. So we created a platform, a system to go out and clean these 60 plus key touch points at least once an hour, and in some cases, it's every half hour. Another component of this is that we recognize that guests come in the store and they could be coming from anywhere. We needed to provide sanitizer at key locations in and around areas that are where we would consider higher traffic. And even though you have the 6-foot distancing mechanism, we know at given windows of time, those people can be congregated in a short window of time, knowing that they're only in that store for 3 minutes. So that was kind of the original approach to all of this. We have recognized, though, you know, with the stay-at-home policy and not being able to be involved in the self-service part of our business, that's a key element that's been detrimental to our business for this window of time. You know, it's interesting the science behind some of the self-serve information out there, but we feel that, you know, we recognize that reopening up doesn't mean the virus goes away. So again, as we come out of this thing and open up the business the way that we see in our hands, we're taking a science-based approach. It'll be methodical. It'll be a slow, if you will, turning of the dial, like many say. And what we want to do is recognize both our coworkers and the guests' health in doing this. Internal in our system, when we have illnesses, and you know, we've been touched by the COVID situation in our organization, we have worked directly with the counties of which in those areas. We feel that the rhythm or cadence that we've created with the counties we work with has been outstanding. And I would challenge anyone that talks to the counties of which we've done, work with them. They recognize that we try to be on the forefront of, we call it excluding people in our organization if we feel that they've even been near somebody that may have tested positive for COVID-19. So we've kind of gone above and beyond in that area from a public health standpoint. And I think the counties have recognized that. With that said, it also helps us reduce the risk internally with our coworkers in our organization. I guess as we move forward and we come out of this, and I was so glad that Ann brought up, some of these key components in that low, medium, and high. We used that early on with our coworkers if somebody tested positive and made sure that we eliminated or excluded even the low potential risk coworkers and paid them for that time off. So I think as a whole, as a company, we try to be on the forefront, but this is not easy. Again, reiterate, there is no playbook here, but we are using more of a science-based approach and methodically turning the dial as we come out of this. But it has impacted, as Steve alluded to, the self-service side of our business.
Just one other quick comment too. Thanks, Jay. As I said, we're vertically integrated, so we have our own production facilities here on campus in La Crosse. We have our own distribution center, over 2,000 people employed here on our campus, and we've yet to have one positive case. And we really look at all the practices that we've put in place to care for our coworkers and on campus, and the same things that we do at our stores. So we feel we're very blessed in that, but we're thankful for that. And as Jay said, we realize the COVID's still out there, even though some of the things are being relaxed, but we are not going to relax our standards that we've set. Thank you.
Thank you, Steve, and thank you, Jay, for that detailed explanation of how you guys are fulfilling the first mission of this webinar series, which is adapting to survive. Quick question from the audience. Are you requiring that masks be worn or face coverings be worn by employees or by customers entering the stores?
We have decided to follow the CDC and FDA guidelines. So what we have decided to do is we highly recommend we supply 2 masks for each coworker on campus. We are in our production facilities because of the events that have taken place in the industry in the very close proximity and dwell time. We have required at our production facilities to wear masks in hot zones that we call hot zones. They are highly impacted communities that may be associated with production closed. We have mandated, and it's in all 3 states, we've mandated masks to be worn. Otherwise, it's highly recommended, and we hand the mask to our coworkers.
Very good, thank you. So we've got to keep moving. We've got someone, so now that we've heard from someone who's adapted to survive, we've got someone who's evolving to thrive. Mr. Rick Chernick is CEO of the Camera Connection Connecting Point up in Green Bay, and we're going to turn it over to you, Rick. Take it away.
Thank you very much, and thank you, Eric. And it's Camera Corner Connecting Point. I'll get you there yet. And Barb, thank you very much also. That's all right. I want to thank Paul Jaden also for getting us on here today. He must have thought that the product that we're selling is pretty cool. But I also wanted to just make mention that Jay and Steve, what your company does in the state of Wisconsin is great, and we really appreciate you being here and being based in La Crosse. You guys are outstanding. So Camera Corner Connecting Point's been around 67 years. My father actually in 1953. Technology solutions provider based here in Green Bay with offices in Buffalo Grove, Illinois, and also in Atlanta. For those that don't know, we specialize in audiovisual, IT, and cybersecurity. Repair department, fix most everything we do sell, from TVs to computers. We have a managed services division, so we manage the computers for many, many small to medium customers who don't have an IT staff. We sell voice, both on-prem and cloud, and we also have a retail store, which is how we started. Camera Corner, just for a little history and tell you how we stand in the country, In HP, which is one of our largest providers of technology, we're in their top 10 in the country. And a lot of people don't realize how much product we actually move out of Green Bay and out of Illinois now. We're in the top 35 audiovisual resellers and the top 200 out of 15 to 20,000 resellers in the US for IT equipment. So I just wanted to give you kind of a feeling. We're not as big as Kwik Trip or Kohl's or any of the giants you've got out there, but I always tell my people I feel like a Chihuahua who thinks he's a Marmaduke. Anyway, since I feel like Jimmy Kimmel and I can't hear you laughing or not, I'll just keep going.
I'll laugh for you, Rick. Sorry. That was a pretty good one. I like that.
All right. So challenge started for Camera Corner also in March, pretty much like everybody. You know, we had a real busy month of March. We had the work at home actually work to our benefit. We had so many laptops and monitors and video cameras going out the door that it was a challenge really to get product in time for the customer. So that was a positive thing for us, but I'd rather give that up and get the hell out of this thing. So we sent everybody home on Monday the 16th, and we decided to close our retail store on the 20th. And the reason we pushed for a faster close on that than I wanted to was we started to get an awful lot of walk-in people just browsing and looking because everything else was shut down. And we decided to lock it up on the 20th of March and put the precautionary steps into place because we are an essential company. So we carefully reopened just this week on Wednesday, the 13th of May, and put in a lot of new stipulations and protective methods. So it's working great. Our people are great, and we're taking care of a lot of customers. We're dealing with this same issues that many of you on the call are, actually probably every single one of you. And I ask the same questions, but I'll just bring them out. I ask our people and ourselves, you know, how long can we survive in a slowdown? You know, when is this going to end? What about our customer base? How are they impacted? Can they sustain good credit? You know, when can I bring my employees back to the office, and how many do I leave stay home? And the bigger question really is, who do you believe? You know, you can hear all the different opinions, and really you sit back and say, where are we with this thing? And I like to relate to it as fighting a ghost. You can't hit something you can't see. Some of the main goals, and I'm trying to keep this moving along because I know we're on a tight schedule, but keeping the customers' employees safe. Obviously, that's the same with everybody. And we want to keep our employees happy, productive, and engaged. It's very, very important to me, and I'll get into that in a minute. We've had no layoffs to date, and I'm very proud of that. We have not laid off one person, although we have many that are just sitting at home and not able to do their job because it's unable to be done from home. But we did not lay anybody off. Our people are the world to us, and we're going to continue as long as we can to keep them employed and paid. We also reached out to help the community. I won't get into all the things. Everybody that can is doing their part. But one of the things, I have a daughter who's a police officer, and a son-in-law is a Brown County police officer, and we delivered a lot of masks over to the departments because they didn't have any. And I just got a text today that they're using them, and we feel so great about helping them. So what are you doing that's unique was one of the questions that Eric had asked me. And you know, everybody's doing their own thing, I think. But if I can give you a couple of tips. Right now, I went around the store when we had a skeleton crew here, and I said, let's leave the doors open. We've got the controls to get us in with our cards, but any door that is not mission critical, like a break room, open it up, because the fewer touches you have, the better. You don't have to grab that door handle. We gave every employee and family member a mask or two, and because right out of the gates, they didn't have them, and I wanted their kids and their parents to have them, and the spouses. So we gave every employee who wanted them, for every member of the family, a mask. It doesn't seem like a big deal, but to a lot of them it was. I did a work from home survey for our entire company to find out how is the experience going. And it was interesting to find out the many things that we did find out from them. We think that just because you're set up and you're working, that everything's great. We found out many of them had very uncomfortable chairs. So we immediately sent chairs to their homes. Their internet service maybe was slow. We went and sent an engineer out to find out what could we do to make it better and faster for you. There were lots of other things that went in. We found out 13 of our 120 at home didn't even have a camera, and we thought everybody did. So shame on us. But by asking the question and having it anonymous and then finding out, we could reach out and help these people. Some of them even had poor lighting in the rooms they're in, so we sent some lamps over. The one other thing we did for the frontline workers, we have about 38 that were working in a warehouse, still helping to get product out to the customers. And we gave them a hazard bonus last week on their checks, a substantial one, because they're in the line of duty every day here and they're not complaining one bit. And we appreciate that. So then the next question was, when coming back, what are you going to do? I said, we're going to implement a lot of changes. One of the biggest things we're going to do is make sure everybody has a laptop with 2 docking stations and the right monitors at home. It's a little bit of an expense, but we're going to do it because I'm afraid that something like this could maybe happen again, and we want to be ready for it. We're going to stagger the people coming back nice and slow. We're going to really make sure that we do it safely. We're going to follow the guidelines, and we're going to review whatever WEDC sends out in your emails. By the way, you know, everything you're sending out, Barb, is great, and we appreciate it. I've been reading it and passing it on to our people. One of the things that I'm going to do for our folks when they do start to come back, and I already ordered the face masks from the Packer Pro Shop, so Mark Murphy will be happy I gave him a little tag here. But we ordered Packer logoed face masks, and we're going to give everybody one of those, and I'm sorry if you're a Bear fan. And we get them hand sanitizers and a pair of gloves in a box. It'll be on their desk when they get back. And so we're just trying to do a little extra to make them feel great. We want to learn on the fly. And one of my biggest worries for me is our culture. I'm a person that really loves face-to-face interaction. And I look at our company as being more of a community of family and friends. It's not just a business. And that's what's made us successful. And that's why Camera Corner doesn't have high turnovers, because we treat our people the best we possibly can and we care about them. Now I'd like to move into the final part of my presentation. And I want to thank Paul Jaden, because he really thinks that this product is kind of cool. So I think so too, and I'm going to give you that. So if we could put that slide up, that would be great. I'm going to talk real quickly about the Meridian Hewlett-Packard Personal Management System. If any of you read the Wall Street Journal yesterday, it happened to discuss how airlines and airports will be taking your temperature now. And it looks like they'll be taking it at the time you walk up to check in with your bag versus just up by the TSA or while you're getting on the plane. Because if you would have checked the bag, then you got to deal with that later, say, how do I get my bag back? The other day, I went into Bellin Hospital in Green Bay for an appointment, and I was greeted by a nice greeter, and I was asked several questions about my health, and they actually took my temperature with a handheld device. Thus, it leads me into what I'm getting into next. The device you see in front of you is a kiosk, and it's one of the best tools available today for a business to achieve any or some good level of safety. So it comes fully assembled. It weighs about 35 to 40 pounds. Very simple, I'm told, to set up and use. Our first batch will be arriving here on May 31st, and then it'll be about a 4-week delivery after that. The unit very easily checks your temperature, probably within a second or two of walking in front of this device, and it's accurate to within a half a degree. It's non-evasive, so although the Bellin situation was very non-evasive to me, still had a human being walk up and stick this device in front of my forehead. And I thought, okay, our device is going to be a lot easier. And it works from 1 to 4 feet away. So you don't have to be right on top of this thing to work. It'll simply scan for a fever. It'll sound an alarm if you have a higher fever. And that way you would know. And a red light will shine on the top of it as well. It's designed for inside use, not outside. The camera itself will actually tilt. We've been very successful in marking them. And one of the questions I had from my friend at Aspiro, where they have some handicapped folks, he said, Rick, can we get it to tip down to accommodate a wheelchair? And I said, absolutely, you can. It works for different angles. So employee profiles will also be able to be put into this thing and downloaded in the future, very near future, and a remote management feature will be built in. So you'll be able to have a fleet of these units around various regions of the country, or your operation, whether it's all in one state or it's multiple states, you'll be able to communicate the information received down the road. Today, the unit is strictly a temp tester. That's it. Within 30 to 60 days, we're told that it will then do more than just the facial recognition part. It'll actually store up to 30,000 images later. So I'm sorry that I'm going through it so fast, but it'll be very interesting. So if you had like 25,000 employees and they're coming through the door one at a time, it would tell you Rick Chernick has a temperature, and it might also be hooked up to the door lock, and it would say you can't get entry today. It would then send an email off to HR so they know that Rick Chernick has a fever. We did not let him in the building. We don't know all of what this thing will do, but the company's been around 20 years and they're making these products and they're selling very well right now. We just need to get our hands on more of them. There will be a countertop version and a battery operated version that's coming quickly as well. In no way am I saying that this is going to replace actual testing, and it cannot tell you if you're infected. It can strictly tell you if you have a fever. So without any more talking, I'd like to run that short 43-second video, which will give the viewers a little bit better idea of what we're talking about here.
Very good. Austin, take it away, and remember to unmute yourself.
Introducing the Personnel Management Solution, a check-in temperature verification kiosk by Meridian. It can be programmed for facial identification with users easily added in a few short clicks. For sanitary environments, it features mass verification as well as temperature verification to help decrease the spread of bacteria, germs, and viruses, protecting the health of both employees and guests. Alarms can be added for those above the temperature threshold and strangers that don't have authorized access.
Very, very cool, Rick. Thank you very much for your remarks there, sir. I appreciate that. In order to stay on time here, I'm going to keep us moving, and we've got a third and final poll coming up. So, Rick, stay on camera for me, and maybe Missy hop on and join us as well. Anybody else who wants to come up? The third poll is, again, same answers as the last two, different question. How long will it take for the jobs that have been lost in the past few months to return to pre-pandemic levels? Less than a year, more than a year, less than 3, more than 3 years, they'll never return, or I don't know. Please get your answers in. We've been plateauing at about 65 to 70% participation on this, so really, really appreciate all of your input, audience. It's very, very important for us to gauge sentiment like this and feel what you're feeling right now. So please get those in. I want to remind the audience also that there's a post-webinar survey that will be popping on screen at the close of the webinar. Please stick around and complete that for us. It helps us to understand what you guys want to learn about next and what topics we've missed, as well as generally how you're feeling about things. So we're at about 54%. Rick, any remarks on the poll?
I'm trying to see the results here for you, buddy.
Oh, I haven't showed the results yet. I'll close it. We're at 60% and throw the results up, and then you can see what we're talking about. Less than a year, 17%. More than a year, less than 3, almost half. More than 3 years, 17%. They'll never return. That's a positive outlook. Only 2% believe that, and 17% don't know.
Well, I really hope that it gets back to normal a lot quicker, but I'm thinking it's going to be less than the 3 years. It's going to take a while.
That's good. Missy, what's the state planning for?
Yeah, I mean, I continue to think, as I said before, that we're in this for a longer haul than we all hope. And I would anticipate 3 years is pretty realistic.
Real quick, I would like to could I just tell you it's $26.50 per unit on singles. I'm getting text messages on my computer already from people asking. So sorry about that.
And $26.50 is $2,650 US, correct?
Yes, sir.
All right, thank you very much again, Rick. We'll have you back here for Q&A if we've got some time. We've had a bunch of questions, everybody, and Missy, I was going to give you the final word as our pioneering moderator on this webinar series, and I want to hear from you last. If people want to stick around, I'll leave this open for an extra 5 minutes to handle a few more Q&A items. Dr. Raymond, feel free to jump back in, and Christiansen, jump back in, guys from Kwik, etc. But Missy, take it from here.
Well, again, just appreciate hearing everybody's continued thoughtfulness about employee safety and the public health safety. It's really something that I think we've heard through all of these webinars is the focus on thinking about how do we return to a new normal and how do we do that safely. So I really appreciate that. There's been a few mentions of the WEDC guidelines that we've made available, and so I hope folks will take some time to go visit our website at wedc.org and be able to view those and give us input on them. We are learning, as Dr. Raymond and Christiansen have pointed out, we continue to learn more and more about the transmission of the virus and smart, practical ideas for preventing things. Rick had a number of great suggestions for what they're doing. And, I think we need to have that collective knowledge that we work together on in order to be able to move forward and continue to recover from this and hopefully not have any setbacks. I was quick, Eric. Sorry about that.
That was great, Missy. Well done. Love it. Why don't I say some final remarks here, and then if you guys can stick on for a little bit of Q&A. I just want to remind everybody that we will be back again next Friday. I want to thank our panelists, first of all, Dr. Raymond and Christiansen, Missy Hughes, Steve Loehr, Jay Ellingson, and Rick Chernick. Thank you guys very much for making time to come on here. Incidentally, it's not just the hour they spend coming on here. They also have to hop on a technical check with us the day before to make sure all their equipment's working, and it's a big time commitment. If you run an organization or a CEO of a company and you'd like to be on one of these webinars in the future, we encourage you to reach out to us. Add that remark when you complete the survey after we close, please, and let us know about that. We're recruiting for the summer. I want to say again, if your company's in need of business assistance, and Austin, feel free to advance to the RLC's map here for me. The Regional Leadership Council and their 9 regional economic development organizations across Wisconsin are ready and available to help you. You can see the contact information for each of the organizations highlighted on this slide, and you can download the slides in the handout section of the control panel so you have that information at your fingertips. Along with the slides from today, details about Badger Bounce Back and Wisconsin Ready are still up there from last week. I strongly encourage you all to take a second statewide business survey being conducted on behalf of WEDC and the state's 9 regional economic development organizations by UW-Oshkosh. That survey is collecting data on the level of economic hardship being experienced by Wisconsin business due to this pandemic, and the link to the survey is going to be available in the side panel there as well under chat. Our next webinar, next slide please, Austin. Our next webinar is next Friday, May 22nd, 11 o'clock. It's focused on the implications to jobs and the workforce in the near and long term. It's going to feature in particular Mr. Caleb Frostman. He's the Secretary of the Wisconsin Department of Workforce Development, as well as Ms. Rebecca Kowalski. She's the Vice President of Manpower Manufacturing at Manpower Group. So with that, for those of you who have to go now at the top of the hour, thank you again for joining us. Please complete the survey. We're going to close it here in a couple of minutes, but I'd like to have whoever can stay on for a couple of questions, please stay with us, and we'll address those questions here at the end. Come back on camera if you're able to stay. Hello, Doctor. Hello to Ann. Thanks for sticking around for us. I'm going to bring up a couple of questions for us, and one of them I think you'll both be interested in addressing. Where'd it go now? It just disappeared. Here we go. On my way home from work yesterday, I passed a street with many restaurants and bars. For the last several weeks, the street has been empty of people and cars. Last night, the parking spaces on the street were filled and the bars were packed with people. Apparently, those business owners are not listening today. How hard and fast will we be hit with the second curve at this rate? Outlook doesn't look good to me.
From a public health perspective, I anticipate that we're going to start seeing any transmission from those types of events in about 2 weeks. And in the Milwaukee area, we're looking even at some of the standing up additional testing sites to manage some of those increased cases. Right now, we've got 2 community-based testing sites in the city of Milwaukee area. So we, again, are being forward thinking about what's going to happen in 2 weeks with regard to those cases.
Yeah, 2 weeks is consistent with the biology of the disease. What I would say is a lot of people say, look to Georgia and Texas to see what's going to happen. Texas incidence continues to rise and Georgia's actually gone down. But what I would say is no other state has suddenly dropped their phased reopening. It's sort of the Wild West right here right now. And we may be the case that people look at to see what happens when you stop the social distancing.
Steve, any input on that?
We've heard the same comments from some of our coworkers when they go by some of those before pretty deserted streets and what's going on out there. And we sent out an email and an announcement to all of our coworkers this morning, reminding them that COVID has not gone away and how important it is to continue the practices that we've done the last number of months.
Eric, we can't hear you.
Muted, Eric.
Thanks, guys. That's a rookie mistake, isn't it? So Rick Chernick, hopefully you're still here and can hear us.
I am.
Thank you, sir. We had a question from Paul Jaden actually come in a couple of minutes ago.
I refuse to talk to him.
You don't want to talk to Paul? All right.
No, I don't want to talk to him.
I'll let him know.
All right.
But all of our panelists, I'd love to hear your opinions on this. His specific question for you, Rick, was, do you see the temperature hardware being used at Lambeau Field when the Packer season gets underway? And I guess for the rest of you, what do you think about that temperature taking technology that Rick talked about there?
That's an interesting question, Paul. And I can tell you that the Minnesota Twins already ordered some. We are scheduled to have a meeting with parts of the NFL actually, and that call was supposed to come on Tuesday. I'm not sure if this particular product can handle the demand. That is a pretty fast-paced, large quantity of people. And this is just my opinion. I have not gotten it into our shop yet. The first one will hit here May 31st, we're told. It will be in all of our locations. It will be to protect the customer and our employees, but I don't know if it can handle the capacity that Lambeau Field would have at a particular gate entrance. That is to be determined. There are other units out there that sell for over $20,000. Those perhaps would be able to do a larger, faster moving crowd of facial recognition and stuff.
And maybe I'll direct that to you, your counterpart in Brown County. What do you suppose they're thinking right now about that question?
That question, I don't know what they're thinking, but I do have a response to the temperature. So that is one tool to assess signs and symptoms. I think it's an interesting one and one that certainly could be available for people. I guess my caution would be a lot of the signs and symptoms are very vague, and temperature being only one of them. So, let's not forget shortness of breath, coughing. Then there's other vague symptoms like loss of sense of taste and smell. And then the other point is that incubation can start 2 days before any signs or symptoms. So, I think a temperature check is an interesting idea, but I wouldn't say that it would be it wouldn't be the only thing. I would place a lot of symptom monitoring for employees and customers, that we should be really proactive about looking at our own signs and symptoms and recognizing when we're ill. And then back to public health, that contact tracing. So it's very important if we get notified of an exposure and start to have some of these signs and symptoms, that's an indication that we may be developing COVID and should self-isolate at that point.
Dr. Raymond, any thoughts?
Yeah, I agree with Ann. I don't have anything to add.
Great. I'm going to ask one more question, and it's related to the statement Ann just made about contact tracing, and then we're going to wrap to let you guys get on with this brilliant summer day that's emerging here in southern Wisconsin, where I live, and wherever you are, hopefully in Wisconsin or beyond. The question was from Martin. He asks, does contact tracing differentiate the difference between someone who got the disease via Walmart or somewhere like their local bar? And I guess that the context of transmission is a really important question that I hadn't thought about before, and that stood out to me as a good closing question to use for you guys.
Yeah, so the disease investigative process is really looking at the case, the person with the disease, and looking at all of the places that they have been and starting to create that map of who else has developed disease based on that case. Sometimes it takes different generations of spread to find out, oh, you actually acquired the disease in a specific location. So oftentimes that information isn't known for quite some time. And sometimes it's not known at all. This issue of community transmission is defined as we don't know where you got it, but in many cases we can pinpoint, again, after a long investigative process, we often can pinpoint where that beginning was.
I would only add that in some cases you can do full RNA sequencing of the virus and look for mutations, but it isn't mutating particularly quickly, and most of the strains in the Midwest are pretty similar to each other. So using that as a forensic tool probably isn't a high option.
Well, thank you again, panelists and audience. We had more than half of our audience stay with us through those extra questions. I won't take any more of your time, but I hope to see you back here next Friday. Ann, Steve, Jay, all of you guys, Rick, you're all invited to join back here again. And Dr. Raymond, I hope to see you back here next Friday.
Thanks, Eric.
Thank you.
Bye, everyone.
Thanks, everybody. Have a good weekend.